Comprehensive genomic profiling is a platform that does require some upfront investment. I always tell my patients it's probably the best money spent in terms of guiding therapies, but it is not always accessible. There have been some payers, including Medicare, that actually approve comprehensive genomic profiling at the beginning of a treatment course, but some still consider this experimental. In my opinion, it's a very short-sighted view on this, because we utilize this information to not only create the best medical outcomes by allowing us to apply the science that we already know, but also to avoid unnecessary cost exposure. So my ideal scenario is to have a next generation sequencing profile for every patient available at the beginning of their treatment course. Sometimes it has to be done through patient assistance. I think most laboratories have been found to be very cooperative and to help us make this information available for patients if no insurance coverage is available. But it's really difficult to provide standard of care treatment if this is not available. In a second step, and I think this is where the investment actually starts paying off beyond the clinical benefit of next generation sequencing, is we have a lot of guidance. Give you another example. You have a patient that has a red rearranged non-small cell lung cancer, and you know this is a disease space that typically has been missed. It's not a very common mutation, but one that is very impactful, and where clinical trials and soon expected FDA approvals will help us treat patients for a long time with minimal amount of side effects. This is going to be very helpful for patients. They're going to be continuing to work. It's going to be allowing them to continue their insurance coverage and other support factors. But it's also going to help us prevent negative therapies in this setting. We know from retrospective analyses that in RET fusion positive cancers, immunotherapies are highly ineffective. It's actually one of the best markers to predict no response to immunotherapy. And if you can imagine, if you can save 3 to 6 months of immunotherapy as a highly cost-intensive therapy, you actually help the patients in both maintaining a regular life, quality of life, and also allow them to reduce the financial toxicity of their treatment, and also avoid unnecessary toxicities in the clinical space. Obviously, we always think of immunotherapies as very, very gentle therapies, but unfortunately, the experience is that some of these side effects can be severe and sometimes fatal if not recognized early and treated early on. So I do think this is a good upfront investment for payers and clinicians to actually help avoid the impact of therapies that may not be helpful or indicated in this disease setting.